Agenda setting is a cornerstone of cognitive behavioral therapy, also known as CBT, providing structure, collaboration, and clarity in each session. A well-constructed agenda ensures that both therapist and client are aligned on priorities, that time is managed effectively, and that therapeutic goals are translated into actionable steps. Recent scholarship emphasizes that agenda setting is not a mechanical checklist, but a dynamic process that requires sensitivity to client needs, cultural context, and therapeutic alliance, as per Beck, 2020, and Kennerly et al., 2017. In this presentation, I will review the 7 agenda setting items, critically evaluate 2 demonstration videos, Grande 2015 and Qualia Counseling Services 2017, share my preferences for counseling style, and identify common difficulties new counselors face in agenda setting, along with strategies to overcome them. 7 agenda setting items. A brief review. Number 1, having a check-in and mood rating. The session should begin with a brief check-in, often including a mood rating, usually a scale between 0 to 10. This anchors the session in the client's current experience and provides a baseline for evaluating progress. As per Beck, 2020. Number 2, review of previous session and homework. Homework review consolidates learning and identifies barriers. It ensures continuity and reinforces CBT's emphasis on skill practice between sessions. As per Kazantis et al., 2018. Number 3, identify client priorities and therapist priorities. Collaboration is central. The therapist elicits the client's agenda first, then adds necessary items such as risk assessment or homework troubleshooting. As per Kennerly et al., 2017. Number 4, collaborative goal for today. A specific measurable outcome is defined. So, for example, develop a coping plan for panic at work. This aligns with SMART goal principles. Boven Edert et al., 2009. Number 5, prioritize and time box topics. The therapist and client agree on which topics fit today's session and allocate approximate time. This prevents drift and ensures completion of high priority items. As per Beck, 2020. Number 6, it's important to plan methods and tasks. Techniques such as behavioral activation, thought records, or exposure are selected to achieve the agreed goal. As per Kennerly et al., 2017. And number 7, it's important to summarize, assign homework, and confirm next steps. The session ends with a summary, collaboratively designed homework, and confirmation of next steps. This reinforces accountability and prepares for continuity. Kazantis et al. Kazantis et al., 2018. All right, I'm now going to move on to a critical evaluation of Grande, 2015, the video. So Grande's role play demonstrates a structured approach to agenda setting. Some strengths associated with this video. There was a clear check-in and mood assessment that helped establish focus early. There was homework review that was integrated, showing continuity and problem solving. Client priorities. Those were solicited, reflecting collaboration in the session. Some limitations that I noticed in the video. Time boxing is implicit but not explicit. So topics risk expansion without clear boundaries during the session. Outcome specificity could be improved. Goals are discussed, but not operationalized into measurable outcomes. And finally, process checks. So for example, alliance, pacing, these are done but minimally, which may overlook relational dynamics. My final evaluation, Grande's video is strong for teaching structure and continuity. It models CBT's scaffolding, but would benefit from explicit time management and outcome contracting. Next, I have my critical evaluation of Qualia Counseling Services 2017's video. Qualia's demonstration emphasizes relational tone and client autonomy. Strengths that I found were that the client-led priorities were foregrounded, which enhanced autonomy and buy-in from the client. The specificity of tasks aligns strongly with SMART goals and principles. The tone and pacing in the video are gentle, reducing performance pressure. Some limitations that I found. Homework troubleshooting is limited. Barriers are not fully explored. This risk and process monitoring are minimal, potentially missing safety concerns. Outcome specificity and time boxing are weaker, risking drift during the session. My evaluation, Qualia's video excels in relational stance and collaboration, but lacks structural rigor. It models warmth and autonomy, but needs stronger outcome, contracting, and risk monitoring. Finally, my preference and counseling style. So my preference would be to combine Grande's structure with Qualia's relational tone. So taking Grande's scaffolding ensures clarity and continuity, while Qualia's warmth fosters alliance and autonomy. The ideal blend is a structured agenda with measurable outcomes delivered in a collaborative, client-centered manner. This balance aligns with contemporary CBT, which emphasizes both technical precision and relational sensitivity, as per Beck 2020 and Kazantzis et al. 2018. Common difficulties for new counselors in agenda setting. So first off, we have agenda drift due to over-inclusion. Looking at this, often new counselors will include too many items, which leads to incomplete sessions. A strategy for mitigating this is to use a visible agenda list, cap it to 2 to 3 items, and defer lower priority topics. Number 2, vague goals lead to fuzzy outcomes. Sometimes counselors can end up with broad goals in an effort to reduce anxiety rather than specific goals. A strategy to prevent this, to prevent vague goals, is to translate them into SMART goals and session level outcomes. As per Boven-Ettert, et al., 2009. Finally, number 3, homework avoidance or barriers that go unaddressed. Clients may avoid homework, and counselors may not troubleshoot this effectively. A strategy for this is to normalize obstacles, co-design graded tasks, and check feasibility with confidence ratings. This is as per Kazantzis et al., 2018. Some strategies to overcome difficulties. It's important to make sure that time boxing and prioritization explicitly allocate minutes per item. Another strategy to overcome difficulties is outcome contracting. Define the session success criteria. So, for example, if today is successful, we'll have X. Do some barrier analysis. Explore obstacles to homework and co-create solutions. And lastly, alliance checks. Briefly ask about pacing and collaboration to strengthen engagement. These strategies align with evidence-based CBT practices and enhance both structure and alliance. As per Beck, 2020, and Kennerly et al., 2017. Conclusion. Agenda setting is both an art and a science in CBT. It requires structure, collaboration, and sensitivity. Grande's video models scaffolding and continuity, while Qualia's video models warmth and autonomy. My preference is a blend of both styles. Structured agendas with measurable outcomes delivered collaboratively and rationally. New counselors often struggle with agenda drift, vague goals, and homework barriers. But strategies such as time boxing, SMART goals, and barrier analysis can mitigate these challenges. Ultimately, agenda setting is most effective when it balances technical precision with relational sensitivity, ensuring that each session is both structured and humane.